patient would have an NG tube is for administering medication, removing gas and fluids from the stomach, if the stomach is obstructed somehow, or maybe they have blood in the stomach from trauma. In addition, NG tubes are also used for short-term feeding. So there's several different uses for NG tubes, and there's also several different types of NG tubes. So when you get an x-ray order, the ordering doctor might say abdomen x-ray, and then in the comments they'll say NG tube placement, okay? So we as x-ray techs do a lot of abdomen x-rays for NG tubes specifically.
What is NG?
Nasogastric tube.
All my portable people.
Yep. We'll be doing those abdomen x-rays for NGTs all day long.
What are the reasons for having that NG? Sorry. I know, I think you have like notes on that part for
Yeah.
put them in here, or
It's in the chapter.
you have those little notes as well?
Everything I get on the PowerPoint is from your textbook. So the reasons for NG tube insertion, they're all listed in the chapter. Alright, so like I said, nasogastric tubes are plastic or rubber tubes, 14 to 18 French, inserted through the nasopharynx into the stomach. And why do you think we need to know about NG tubes? I just said it earlier.
Replacement.
Yes, because we take x-rays, so many of them, on the daily to check for NG tube placement. So we need to know what they look like and where it should be, or where it should be in the stomach. Right? Sometimes the doctors they're notorious for holding us hostage near the patient's bed and making us take x-rays after x-rays while they insert it, adjust it, insert it, adjust it. And I personally have been held hostage at Bentop. I think at one point I probably took 10 or 11 x-rays on this one patient. And they thought that they would just, get away with it and say, okay, well, thank you. They only had one x-ray order. I was like, by the way, you owe me 11 x-ray orders. They're like, oh, okay. I guess they didn't realize they would need to put in that many orders.
Otherwise, it would have been like 10 or 11 repeats, right?
Yes. Sometimes the residents think they can get as many x-rays as they want to under one order, but if you tell them ahead of time, they will reduce the number of times they call you.
Okay.
And they only have to give you an order for the ones they save, or for like each time you hit that button?
Each time you make an exposure, they need to put in an order, because you can't just take free x-rays. Every exposure, you need an order.
Whenever they move it.
But before the exposure.
I just
But like you said, you
Ideally, yes, before the exposure, but, it's a hospital, nobody has time to actually go for the ordering while they're attending to help the patient. So usually the techs will ask them afterwards. Okay?
So is OR different because she said she took a lot?
Like
OR is
I would
different.
say like,
Oh,
Because for surgery, it's a given that you're going to be using continuous fluoro.
oh.
Okay, so that one you don't need.
So that's why I was asking, only the ones you save, those are the ones you.
Correct.
Same with Flora.
Fluoro, yes, same with fluoroscopy procedures. One session is needed for the entire thing. So, Melanie, here you go. Nasogastric tubes are used for administering medications, to remove gas or decompress the stomach, or remove fluids from the stomach after intestinal obstruction or trauma. The most common NG tube used for gastric decompression is called the Levin tube, L-E-V-I-N. Yes, this is specifically used for gastric decompression. It's also in your textbook. Other common ones are the Miller-Abbott, the Dobhoff. The main ones that we're gonna focus on is the Dobhoff. Moving on. So, Are we going to be the ones inserting the NG tube?
No.
Absolutely not. That is the responsibility of the physician or the nurse. Could be a PA, could be the nurse practitioner, not x-ray techs. Our job is simply to take x-rays. Alright, so how will they insert this tube? The patient is going to be placed in a Fowler's position. Anyone know what that is?
What position?
Fowler's.
Just sitting up.
Sitting up with the head elevated 30 to 90 degrees. Basically just sitting upright with the head elevated. Okay? So, a patient that has an NG tube is usually in some sort of pain or experiencing discomfort. I know for a fact I wouldn't want a plastic tube down my throat.
You said it hurts.
It hurts, yes. Remember when we had to get that COVID test with that long swab down your nose until it tickled your brain? That was extremely painful. So just imagine these patients have to have this tube down their throat for sometimes weeks and months at a time. So it's really important that if we have to encounter them in the x-ray department especially, that we don't accidentally pull the tube somehow, because that thing hurts, and the patient's nurse and doctor will not be happy with us if that tube is out of place.
Is this the same thing they do to inmates when they don't wanna eat? You know how they do that? They force you and they put a tube on you, that way you can eat.
I don't know about
If
that.
you don't wanna eat, that's your
If you
choice.
wanna eat, they tell you go
I-
ahead.
But if they don't wanna eat, they place you like that tube down all the way.
But they cannot teach you.
I asked the girl who was doing like overtime, I was like, are you mad today? She's like, no. Felt like you were.
Alright, so how is this tube inserted? The tube is lubricated at the end, and then the patient's instructed to swallow while they insert the tube. I'll go more into the details in a couple seconds. So, the NG tubes, like I said, are inserted by doctors, nurses, PAs, etc. And we never insert the NG tube or adjust it. Our job is simply to take the x-ray image. So the patients are usually placed in a Fowler's position, and the tube is measured from the nose to the stomach to see how, what the distance is, like a rough idea. And then the tip, if you see in the next slide, the tip is weighted at the end to make the insertion easier, okay?
I thought that one was a tube each.
And the tube usually has markings on it that tell you how many inches have gone down into the stomach. And the tip is lubricated, so it makes it easier to travel down the nasopharynx. And while this is happening, the patient has a cup of water or juice or something, and the patient is instructed to swallow while the tube's being pushed down. Why do you think that is?
To help
Open up
with
their
our
esophagus.
Like a
Help it
compression.
move down, but more specifically,
Protect.
you don't want the tube to go down the
Right.
trachea, correct? And what does swallowing do?
Closes
Open
the,
the-
back on the trip.
Correct. So we don't want this patient to aspirate it into the lungs, so that's why they have to swallow. So it goes down the esophagus and down to the stomach.
Has it happened before?
Oh, yes.
Oh.
And usually the patients will be given an emesis basin just in case they do gag and need to throw up. Okay?
What do they need to give, what will they give it, master?
An emesis basin,
Those kidney shaped basins are called?
yes, emesis basin.
Emesis.
I believe it's in the chapter.
Yes, it is, yeah.
And once they think that the tube is in the right place, a stethoscope is used to listen to the stomach for a whooshing sound. Okay? And also at the tip, the nurse or doctor can attach a syringe and make sure that they get some sort of gastric fluid back to make sure that it's in the stomach. Okay? So, a dog hop tube can can be abbreviated as a DHT. It's a type of nasogastric tube, but it's strictly only used for feeding. So a Dobhoff tube is a type of what?
Nasogastric.
Nasogastric tube used specifically for feeding, yes. So it has a weighted tip and it usually has markings on it that show you how many centimeters there are. And then if it's purple, that will tell you if it's a Dobhoff tube. Used only for feeding, not IV access or anything else. And please, this is a pet peeve, know how to spell Dobhoff. I've seen radiologists order this in multiple ways, and I'm like, how? How are you a doctor and you don't know how to spell this? Dobhoff.
Remember that it's for food, just look at the F at the end.
Oh, there you go. Dobhoff as an F, so food.
You said it's always purple?
Uh-huh. Purple indicates that it should be used for feeding. So it's named Dobhoff because it was invented by surgeons Robert Dobby and Jim Hoffmeister. So they just took the Dob and the Hoff, put it together.
Where's the marker on that last image? I see D.
Oh, there is no marker. No marker. So do you see the Dobhoff right there? So if it's on the left side, where is it? In the stomach, exactly. So this is typically what we want to see while we take an x-ray. If it's going to the right, that's a big
Something ain't
no-no.
right. If it goes to the right, something ain't right.
That's right. So sometimes when we take x-rays, it might look like this. Some sort of kink is happening in the Dobhoff. So most likely, guess what? You will be called back for that x-ray in an hour. Because they will be readjusting this.
Would they just?
That's because they moved, that's
What's
why?
this number?
No,
Or they just didn't decide
See
to
how
do
this
another
is
X-ray.
kinked?
Oh, I see.
But shouldn't they know that since the beginning, cause that's why you're there?
No, they can.
So when we take the x-ray and it looks like this, that means they need to readjust the tube. So they might do it at that point, or they might wait, because if they're busy or whatever the case may be, they'll say, come back later, we'll call you when we're ready.
But the kink, you mean a twist sort of thing?
Yeah, it's
so it
like
blocks the
twisted
thing.
and bent, so we don't want it to be bent, cause that might be a
Blockage.
potential blockage, right? If you're trying to feed them. Another picture of the Dobhoff, you can see the weighted tip here. Sometimes the doctors may ask you to do a chest x-ray instead of an abdomen if they suspect that the tube has somehow coiled up in this area. But most of the time, it's gonna be an abdomen x-ray. Okay? So what happened here, do you think?
Right, ain't right.
Where is it?
Right side.
Down the wrong.
Right where?
Lung.
Right lung, correct. So remember last chapter for Mr. Donahue, we said the right bronchus is what?
Wider.
Shorter and wider. So when we aspirate, where does it normally end up?
Oh, in the right lung.
The right lung.
Foreign object.
So, most likely what happened is the patient was either not swallowing when this happened, or they completely forgot to instruct the patient to swallow. So it ended up in the trachea and then down to the right lung.
That hurts too, I'm pretty sure.
Oh, yes.
So, do they just like?
They have to pull it out.
They just pull it out.
There you have only some.
Meanwhile, the poor patient's gagging and coughing and in pain.
Does blood come out?
Blood shouldn't come out unless there's something else going on.
Have you seen them do that? Like, put them up?
Oh, yes. Mm-hmm.
Those look like pretty sharp kinks though. like as opposed to the other ones were kind of rounded.
Yes,
Those look like
these
they're
look like
folded.
they're like bent really
Yeah.
bad.
So when they take that one out, would it cause some like scratches or inflammation that could cause bleeding?
Well, they should inspect the tube to make sure that it's not ripped or torn before they reinsert it back, hopefully.
Like, I want to see people more. I don't want to.
Miss Bonilla, is this a
Yeah.
kid?
Yeah.
Looks like a kid, yes.
I was gonna ask, how old do you think this patient is?
Little baby ribs.
Look at the shoulders.
Yeah. Probably like a 5-year-old
Yeah.
maybe.
He would eat a lot. Cause I think he had like, he hit his
Did they
head
have
and
a
then he hit his
bowel
head.
issue as well? It looked like they're
It gives you like pressure.
Yeah, it looks like there's lots of air
You can feel the pressure in your
and
head.
obstruction going on in their
Yeah,
intestines.
So-
So
Would it be reasonable to assume that that patient had some sort of issue with their right lung, and that was causing maybe because of the thing? Like, what if they perforated his lung by accident, and they're trying to figure out like what's going on, or if he already had an issue, they rather. Like, could that cause that pneumoperitoneum?
Wait, what is your question?
Like, what could the tube have caused that?
For them to be obstructed?
Is that an obstruction, or is that like air in the?
Looks like it's air and feces.
Ooh, poor kid.
Yeah. So most likely they were inserting this nasogastric tube to do some sort of like gastric decompression,
Oh,
but it just ended up in the lung, right lung.
he's probably crying.
All right, moving on to fun stuff, urinals. So, why do you think we would use urinals in the X-ray department? Patients gotta pee, that's right. So typically used for non-ambulatory male patients. This is for males only, not females. Please don't give this to a female patient. They're gonna look at you like, what do you want me to do now? So, you may have seen this.
I'm sorry. I don't know why that broke me. That was
Wait, what did
funny.
you say?
She said aim. For
Oh,
female.
Example of what not to say to your patients. So you may have seen urinals if you were at the main hospitals like Bentop or LBJ. So if patients come down and they're not able to get up from the stretcher, or if they are in a wheelchair or a stretcher, they can't really move, this is our option to give them a urinal. Do you think we have to just pass them the urinal and walk away, or are we gonna help
You
them?
gotta hold it. Maybe.
Yes.
You gotta hold it?
You gotta swallow your pride and guess what? Hold the patient's anatomy for them to be able to use the urinal. Yes.
We as techs have to do that, or I
Yes.
thought the CNAs did that.
Well, if the patient's in our department and we don't have nurses and CNAs around, it's up to us. Please don't be one of those techs that say, oh, I can't do that. You gotta wait till you get back to the room. So the poor patient's gonna hold their pee the entire time. That's not good patient care. Don't do that, no.
You'll see that a lot at Bentop.
Yes,
Where
sometimes
the
they
techs
don't
will
wanna.
say, hold it, and we'll give you back to the nurse.
Yes, that's just very bad patient care. Please don't be one of those techs.
Okay.
We're in the healthcare field. Unfortunately, guess what? You have to look at some penises, okay? You'll get over it.
You're gonna see a lot.
I'm just not gonna volunteer.
So,
You said you gonna volunteer.
I say I'm not gonna volunteer. Let me clarify that. I'm gonna say it one more time. I'm not gonna
yeah,
volunteer
if
that
you
one.
ever have a situation, just call John's or Jay.
My phone's on Do Not Disturb.
Got us blocked, period.
Yeah.
Like, okay, I'm ready to go, and I'm like,
And
Yeah,
I was like,
oh.
yeah,
there you
bedside
go.
patients have no shame, so they don't care about who
They
they're.
be trying to show it off. I'm like,
Yeah.
Cut it off.
Like, sir, you're 78.
so
Make
It
it
looks
ain't
like
nothing
a
sh-
important down there. Please
I
move.
feel so weird because I've never seen so many in my life, so I was like,
You'll get over it real quick.
Yeah,
Yeah.
Bonilla, it's so cute because I remember feeling like that. And then I'm like,
Yeah.
alright, oh, you wanna be naked? Fine, come on.
Yeah. Like at this point, it's like, oh, okay,
Okay.
another testicle. Great.
no.
All right. So urinals are made of plastic and shaped like this, so it can be used by a patient who is laying supine, laying on their right or left side, or in Fowler's position, sitting upright.
But in the book it says plastic and metal, so it's okay, ma'am.
Back in the day, it used to be metal. Nowadays, it's going to be plastic.
So you can just rule out what's the book says. The old book.
Wait, what was?
The book says it's made of plastic or
Yes,
metal.
it can be made of plastic or metal, but nowadays they've gotten rid of the metal ones.
So
Just know that
Just a
there's
little plastic.
2 options, but most common one is plastic.
Is the metal one disposable? Probably not, huh?
Probably not.
They're probably
Plastic one's disposable.
That's a bad guy.
Alright?
I am pretending to write something down.
So, if the patient does need assistance in the x-ray department, what do we have to do? Assist them, yes. Usually all radiology departments should have urinals and bedpans stocked in the cabinets. I'm not sure where exactly they're located, but ask somebody to find a urinal or a bedpan. And of course, maintain as much privacy as possible, you know. Try to close up the room if you can. If you have to move the patient's gown or sheets out of the way, try to be as discreet as possible. Don't just completely take off their gowns and shirts and expose them completely. Alright, so you would hold the urinal by the handle, and you would also hold the patient's penis if they can't. And then once they're done using the urinal, you would just empty it in a restroom and then dispose of it. Obviously, remove your gloves and wash your hands. Yes.
So this is gonna be a very, let's say, particular situation, but let's say a situation rises and you're no longer comfortable proceeding. How would you proceed?
Hit it.
Well,
Get back down.
Shut the No.
just be professional and
I know you can't do
don't.
Do it.
Who's excited today? I mean, yes.
Also, before you guys empty it, you need to check with the nurse to make sure, because they also look at the measurements.
Correct,
So
correct.
make sure you don't.
Yes, if it's an inpatient that came down with the urinal already on the stretcher, just hang it back on the stretcher, just in case the nurse needs the urine out.
And put it into the thing. You can't just like slip it in there.
Yes.
I had talked to one of my old friends, she's an
Oh,
ultrasound tech,
okay.
and she said like she works at Kelsey Stevens, and I guess they have to do some kind of procedure with that area.
Okay.
And she said one of her co-workers told her that, you know, she was doing the job, the man did what he did and exploded on him. So she was like, I don't wanna work here no more, cause I don't wanna do those things. I was just like, I ain't got time for that.
Wait, what happened?
Mine is showing,
I got a close story.
what-
in the book.
I got a close story to this.
like,
Oh, no.
But we don't
It's
go
just-
by the book all the time.
That's what I'm saying, bro. If I don't know.
I got a clinic
I
story.
cannot handle
Oh, yes.
it.
You
Hell
guys have a
no.
clinic story to share.
So I was in IR, and they were changing out the bag. What is it called?
Colostomy
The
bag?
colostomy or
No, it's the
urinal? Urine bag.
Urine
Okay.
bag.
Uh-huh.
Okay. And basically, so the patient, before I guess the procedure, told the doctor, I do not want a bag anymore. I can't work with it. I can't, you know, like it's getting out of hand. I can't do it anymore. Well, after the procedure, he realizes that they just changed out the bag. And he said, if you don't go get that doctor, I'm gonna take this out and I'm gonna sling it all on y'all.
Oh, no.
So we went to go get the doctor. The doctor said, I have none, you know, it is what it is. It's what you're gonna need. The patient rips the tube and starts flailing his urine everywhere.
Oh my god.
Yes.
Were you there inside?
Yeah. So I was inside. I didn't get splashed. So I was good.
Oh, my God.
But I was like,
I'm gonna turn in my 2 weeks.
Yes.
So
I
quick,
already
so
dude.
you're gonna see some
Using
crazy
the
stuff, guys.
maid
You just gotta be
urine.
professional in that situation because you gotta realize some people aren't
It's
in their
showing
right
us,
mind.
it's a number,
Stay
but
calm.
she has a main unit.
So this-
Sometimes stay
Yeah,
out of
it's
the
a
way.
male.
Because you
That,
don't have
but she
a
doesn't know.
Looks like it's a male patient.
Or, I thought it was a female.
Or it doesn't
Oh,
matter.
that kind of brings me to another point.
Yeah, so then, it must be a male then.
So urinals are, these types of urinals are only used for males.
It is a-
Yes, Jay.
I was just gonna say, like, even if they look like a female patient and they still have that urinal,
Then
you
it's a
should
male.
still treat. I would treat that a
Yeah,
little.
nowadays you,
Yeah,
Yeah.
you got to,
Sound
they
weird.
need to go to the
All I know
census
is
right there.
y'all are gonna feel urine because there's gonna be patients on stretchers that these nurses do not clean up after these patients. So to be able to put the board underneath the patient, like the sheets will still be all wet.
Mhm.
Like, especially if they're a bigger patient that a lot of people you need like a team to move.
Mhm.
You're still gonna be touching urine. So I know you're like, oh, I'm gonna run away from it no matter what. You're not gonna
yeah,
run away
you
from
will
it.
have some sort of fluids or something on you.
Just tell yourself it's sweat. It'll be
That's why I
easier.
always say I
It's-
wish the gloves went all the way up to here.
Damn, you
The
get
best
in
part
there.
is if you're doing a portable and everything is wet and dirty and your glove rips, that's the best part.
Yeah. Mhm. Most
Double
definitely.
dose.
Alright, so, like I said earlier, after the patient has urinated, you will dispose of the urine in the restroom, not in the sink in the department, please. And then wash your hands.
Wait, do we
There's some
wash
nasty
the?
people out there, okay?
Why they showing
Yeah, a
them
lot of
cleaning
nasty
stuff?
persons, definitely.
Please finish
that
your
looks like it's
sentence.
a bedpan.
Please
Yes,
finish your
that being in a
sentence.
bedpan.
I need to know what the rest of it was.
Probably from
Do they
making.
wash the urinals?
Okay.
I guess they're washing it out in like a.
Do we wash our
sterile
hands? I was like,
situation.
oh my god.
No, because in
I don't think it's
that
just a
picture
regular-
she's like cleaning it. I think
Or,
she's gonna use
or
it.
wash the patient. I wasn't sure which.
Wait, Miss Bonilla, quickly.
Yes.
For the previous one, are they cleaning the urinal thing?
Looks like they're emptying the urinal into a bedpan and then washing it. You don't need to do all
You
that.
don't have to.
Because
You
it's
just-
it's disposable, right?
Yeah,
don't
so
need
you
to
just
wash it.
empty the urine in the restroom and just dispose it. Bedpans, used for defecation and urination by women. So if a woman patient comes down to the department and they need to urinate, you would hand them this, not the urinal. And once again, this is plastic and disposable. Jay, you have a joke to share?
I absolutely do not.
Oh.
I will say, Samantha, when this video posts, please upload it. Like, just, like send it to the group chat.
It's going up.
10:58. Go back to that.
So ma'am, for defecation, the
God.
same thing will be given to the male also. right?
Correct, yes. Mhm.
So do you put that in there? They use like.
Typically, we would never hand them this for defecation, because that hasn't happened to me yet. That would be by the nurses or CNAs.
Usually they have a diaper on them.
Mm-hmm.
They bring them all the way to the radiology room just so we can do that. Or
No, there's some
Yeah.
stocked in the radiology department, in case we need to use it, yes.
Oh, that's.
So there's two types of bedpans. This is the regular one, and this one is called a fracture pan. Why do you think we would need a fracture pan?
Which one is the fracture pan?
If the pelvis is fractured, tailbone,
Correct.
things of that
If a
nature.
patient has some sort of fracture going on and they're not able to completely lift their hips up, so you can slide the pan underneath, we have the fracture pan here, which is more shallow and it's kind of contoured better, so it's easy to slide under the patient. So this regular one is about 2 inches tall. This one is not as much.
And they're both called fracture pans.
No, this is fracture pan. This is a regular bed pan.
It's only 2 inches.
Mm-hmm.
Would it be encouraged or like optimal practice to bring 2 just in case, or just the one should be
2?
fine? Yeah. You don't know.
I would say just one is
Okay.
necessary.
Yeah, yeah. I just saw it.
Yep, so the standard bedpan is approximately 2 inches high. Fracture pans are shallower and contoured for patient comfort. And they have a tapered end, which makes placing it under the patient a little bit easier, especially if they're not able to lift their hips up. And that's just a picture of what it would look like under the patient.
The liquid ever.
That look like that's an accident waiting to happen.
Yeah, it looks like a leaker.
Like that
All
would be a
right.
big change.
So now imaging procedures, specifically of the colon. We have several different ways that we can image the colon. For example, in fluoro, we have barium enema, where the barium is administered through the anus to image the colon or what's going on. Be sure to read this, page 253. And then other examples of imaging studies include colonoscopy, virtual colonoscopy in CT, and then sigmoidoscopy.
What page is it?
253.
35.
253.
That's very
Into 21, chapter 21?
This is about
Is
pharmacology.
it barium enema?
Bet you're excited to do this one too.
Is that the wrong page or something?
Yeah, it's
Yeah.
pharmacology.
And it's,
So
it
you
is
said
the big,
259.
it's 235, ma'am.
Let me see.
Yeah, that's going into
The
chapter
barium
21.
enema, 235.
Good stuff, Shaheen.
Ah, okay.
So we go a little bit
It's
So it's
235
part- yeah.
and 236.
235.
My bad.
It's okay, Paul, okay. Maybe, yeah,
dyslexia.
Yeah, I was typing too fast or something.
You meant 235, which was 250.
You were like, do they really gotta know?
No, I was like, let me see if they actually try to find this page.
Who's reading the
Yeah,
textbook
Yeah,
and who's
I
not?
get question.
That should be a bonus.
Yeah, I know, I
Thank
get
you for the idea,
question to
Melanie.
question and find
Y'all
out.
can thank her if I ask about this on the exam.
Page number?
Oh, no, just that one page though, that's 235.
235 and 236. There you go. Thank you, Jay.
Pardon my handwriting.
Alrighty. So, what is colonoscopy? Thank you.
Sorry.
It's typically performed by a gastroenterologist or a surgeon. Takes about 30 minutes. It's a procedure where they insert a long plastic tube into all of your colon, and they're usually able to see the images on a display monitor.
I didn't know this before. I didn't know the
Oh.
tube goes through your entire colon.
Yep, it goes to the entire length of your colon.
It's not hurt.
I'm
No, it doesn't
assuming
hurt.
yes.
Are
It didn't hurt when I had it.
I'm asking what hurts.
so
They put her to sleep. Oh, just sleep.
Yeah.
Oh, okay.
I see there's a link. What's going on now?
Can't drive.
I'm
You
sorry?
don't feel that.
It's on YouTube, bro.
Wake
You
up
think-
and you don't feel it.
There's a lot of wild stuff on YouTube.
Different things right now.
Oh, no, me, I am not. Oh, so
I
you're
still
with
have
me.
some coffee. I'm not trying to.
Drop you out. And when you get, when they stop it, you make right up.
Oh gosh.
It's an animation.
Okay, I'll take that. That's more doable.
Oh, House of Dragon. Yes.
Where my Game of Thrones people?
Right
Right
here,
here.
right here, right here.
What?
Hey, Miss Bonilla, that was super quick. House of Dragon.
A colonoscopy is a medical procedure that lets your doctor look inside your colon and rectum for problems such as ulcers, inflammation, bleeding, polyps, and tumors. A colonoscope is the tool used to perform a colonoscopy. It is a thin, flexible tube with a light and video camera on the end. It is inserted through the anus into the rectum and is carefully guided up through the colon, all the way to the cecum. The colonoscope can usually be used to enter the very end of the small bowel, known as the terminal ileum. The front tip of the colonoscope contains a video camera, which sends real-time images to a computer screen so that your doctor can examine the colon. The front tip also has a light, a channel for water irrigation, a channel for air and water, as well as an instrument channel. The irrigation channel is used to flush water or air into the colon, to remove debris or stool, and see more clearly what the inside of the colon looks like, and to check for polyps. Special tools such as tiny forceps or wired loops or snares can be passed through the colonoscope to remove polyps and take samples, called biopsy, of suspicious tissue in order to look for signs of cancer. A colonoscopy usually takes 30 to 60 minutes and is performed in a hospital or clinic by a trained doctor, known as a gastroenterologist. You will be offered a sedative to help you relax during your colonoscopy, and you will be placed on your side for the procedure. Your doctor will carefully insert the colonoscope into your rectum, and advance it to the end of your colon, to your cecum. The colonoscope bends, so your doctor can move it around the curves of your colon. Your doctor might gently press on your abdomen during the procedure, or ask you to change positions occasionally to help move the scope through the colon. During the entire procedure, a magnified high-definition video from the colonoscope plays on a monitor in real time, so your doctor can thoroughly examine the lining of your colon. Video may be recorded, and photos are taken as well. A small amount of air may be blown into your colon to help expand the passageway so that your doctor can see better. This can make you feel pressure or mild cramping, but can be eased by taking slow, deep breaths. The colonoscope is then slowly pulled out while your doctor carefully examines the inside of your bowel. If your doctor finds polyps or suspicious areas during the colonoscopy, the polyps will be removed and small tissue samples will be taken to be checked for signs of cancer. Polyps are usually not cancerous, but they can change into cancer, and that is why they need to be removed. Polyps are removed with biopsy tools or wire loops that get passed through this.
All right, we'll stop there for today.
Oh, question.
Yes.
Is that the remote control? How is like perfectly taking like notes?
They have some sort of like control at the end where I've seen the doctors like guide it. They're able to like maneuver it according to whichever way they want it to go.
It's like a joystick.
Kind of like that, yeah.
As opposed to like sliding along the intestinal wall.
Correct.
Oh dear.
I'm sure it would hurt. Yeah. Since it looked like it was centered in the intestinal
Could be
wall.
inflammation. Diet.
But if you saw the animation, like every time it moved, he did something with his hands. So I assumed it was like a pump or something.
I had polyps. And I had.
You can get the last
Do they hurt or what?
It depends on where they're located.
But what is it? It's just.
They hemorrhoid.
We out to lunch now?
They hemorrhoid. It's a fatty tissue. A polyp is a little fatty tissue.
Jay, can you stay?
What's up?
Can you stay?
Can I stay? Right now?
Yeah, do you have to go? You need a break?
I was gonna go get some lunch. What's up?
Just for a second.
Yeah, what's up?
Just have a seat.
Oh.
It's gonna be it's gonna be peace. It's gonna be like a peaceful thing. It's nothing intense.
Okay. I see you called in the big guns. What's up, bro?
Is it fully?
Shut up.
No. It can't.
Dude, no way. It's huge.
Maybe it's because these are like way smaller than this. That's what's bigger.
What time is
No.
that? A test?
No, it's
The last
really not.
What
period.
Okay, that makes more sense. I was like, no, no.
That's pretty good.
It's big, but like, have you seen some fucking, some of the things that people use, dude? Like, like,
And then we continue for the test.
bro, I've
So
never
we have
seen,
lunch
I've
break
never
when
seen
we
it
have
on the internet, like on
So
Twitter or
we had to come
something,
back at 12.
where it literally looked like a water bottle. And, dude, literally, it was on Twitter. It wasn't like, it was just so, so, what's going on? Looking, what the fuck is that? And all of a sudden, I see a logo comes up and just basically disappeared. And then gets back up.
So the
And
problem
it's like, you passed out like behind. So it was just like, yeah. That one time when Mr. Donahue showed us a picture of something similar, I was like, yep, I 100% can, like, that makes sense. Because literally,
Yeah, so just remember.
I'm not kidding.
Just remember 16 'cause
That
of the
wide.
test.
Not necessarily like, dude, no, they, like, some of these people could, like, die. Some of these people straight up die because they rupture their organs. I'm not, yeah. I'm not leaving, I'm just gonna throw this away. Did you want attention? Yeah. I gotta wait. I'm gonna get some BBQ. Oi. Watch up there. I still can't believe you said
I
that.
like how you leave your background on this side now.
Yeah, sometimes I have to. I cannot believe you said that. Dude, and it's like, when we whisper, 90% of the time, the camera's gonna hear us.
I mean, I don't. It was a joke.
You said it with such hair on your chest, though. You're like, well, I wouldn't mind doing those. Yeah, HR, hello? I don't mean to be that guy.
Oh, yeah, y'all can tell you're.
പുള്ളിക്കാരത്തി
ഇല്ല പറയൂട്ടുണ്ട് തൊട്ട് പറയല്ല ചില പക്ഷെ കേൾക്കത്തില്ല ഇതാണല്ലോ അല്ലേ
ഇതോണാണോ